Hi, it's Dr. Dean Kane. This patient and I have known each other for over 20 years. When threads first came out, they were for lifting deeper tissue. But now with EuroThreads, we have the ability to both lift tissues as well as to improve all the cellulite and laxity that we see to improve texture and smoothness and firmness. So what we're going to do today is create a lattice work of sutures that are made out of PDO, put them through the skin, develop a lattice that's forming collagen formation and tightening and smoothening. And what we will see here is everything will smooth out just like that. What we're doing now is a EuroThread superficial mesh or matrix of the above knee wrinkles and laxity of the anterior thigh. We're using these very long twisted PDO sutures in the skin, not to lift deep in the skin, but to create a matrix of collagen formation all throughout in order to firm the texture, smoothness of the skin. It'll take 3 months, but it will last for well over a year. Alright, so this is a fun and exciting part. This is once all of the needle trocars are put in, we're just going to rotate the needles so that they engage into the skin. And then that way when we pull the needle trocar out, it's really quite interesting to follow the needles coming through the skin and out. The sutures have been left in. So that's the first layer of what we're going to do, and now we're going to cross mesh it this way and we'll be all set for the day. We're putting a next set of sutures in the opposite direction, in this particular case the horizontal direction across the knee and anterior thigh, to create that matrix effect or lattice effect where we stimulate much more collagen for longer periods of time and therefore end up with a much smoother, lineless or reduced lined leg.
And how are you feeling about it?
Actually, it's unbelievably painless. I feel very, very little. It's not uncomfortable. Once in a while, I'll feel a little twinge, but other than that, it's very tolerable.
And basically all was done was local lidocaine. The patient was able to drive herself here. She's able to drive herself home. And so it's easy.
So we've just completed doing both thighs of this matrix style intradermal injectable EuroThreads for the formation of collagen and reduction of all the lines and creases in the above knee and upper mid thigh area. So this patient has been with me 20 years. She started with me when I had interest in contour threads for the face. At that time, she will tell you what I predicted, and here we are today, finishing up her thighs. We did her buttocks, and who knows where we'll go next.
So yes, I've been with Dr. Kane for 20 years. We did a thread lift that long ago, and we had a conversation when we were doing that about the future, and Dr. Kane said I would really, really like to see thread lifting done over the entire body. So here we are 20 years later. I've done my buttocks today. Well, Dr. Kane and Lori did my buttocks today. I did my thighs today and knees. I'm so excited to see what the results are. I'm almost seeing results as I'm sitting here 10 minutes after the procedure.
And how was the discomfort?
Very little. There is occasional a little ouchy here and there, but very tolerable. And believe me, it'll be worth any kind of little small pain you might feel today to have.
And it allows you to drive home.
I can drive home today, and for me, just being able to wear shorts again is so exciting. I'm looking forward to the summer.
Thanks so much.
Yes.